So dear audience, welcome to the second session of the topic on focus on sickle cell disease for patients and then family. As you know, this is a cycle of 11 webinars. As said, we did already one 2 weeks ago on new therapies for sickle cell disease. This will be available on our YouTube channel and also on our website. With this program, we aim to disseminate very important topics related to sickle cell to the patient community and their families. And we are going to talk about, in general, along all this program, the latest advances in treatment and diagnosis, improving the quality of life, and so on. So today, we are specifically going to talk about adult patients' quality of life. And before introducing you the speaker, even if all of you know her perfectly, I want to share some house rules before. So as you can see, this session is recorded. So if you don't feel comfortable with that, please put your camera off or change your name on the platform. And your microphone will be muted along all the presentation. But at the end of the presentation, or if there are some interactive parts foreseen, you will have the possibility to unmute yourself and intervene, or to write questions in the chat. So both ways are very welcome. So as said, today we are going to talk about adult patients' quality of life. The lecture is led by Dr. Noémi Roy, who is a consultant hematologist at Oxford University Hospital and an honorary senior clinical lecturer at University of Oxford. So please, Noémi, the floor is yours. Thank you very much.
Thank you very much, Mariangela, and hi and welcome everybody. Hello from a very rainy Oxford and happy Valentine's Day. So I'm going to give this talk on quality of life in sickle cell disease, and I'm going to do this for those of you who've met me before. You will know that I love this thing called Mentimeter. So it would be good if you also have a phone with you that you could, or a laptop that you can use to answer the questions, but I'm going to explain how to do it as we go. So today's topic is quality of life for adults living with sickle cell. And let's see if I can move this so that it's down here. Right, so just so that we know that everybody knows how to use this Mentimeter, if you go to the website called www.menti.com and you use the code 62337268. So maybe Mariangela, you can put the code in the chat for people. And if everybody can go to it, then you can log in and it's completely anonymous. I have no idea who's who. We're just going to see everybody's answers anonymously. So once you go to that website, it will give you a choice to put a code in. There we go. A few people have worked it out. The code is 62337268. Press submit, and then you have some options. I think we've got about 15 people logged in, so I'm going to wait till the number of people who've answered this question goes up a bit. So we've got 7 people who've answered. If anybody doesn't understand, maybe just raise your hand. And well, I can't see who's raised their hand, but maybe Mariangela, you can explain it. So you go to this website, www.menti.com, and then it's going to ask you for a code. and you put in this code and you can answer the question. Right, we're going to move on. So what is quality of life? It's a really difficult thing to try and define. So quality of life encompasses lots of different aspects about people's lives. And obviously health will be a very important part of it, but quality of life goes beyond health. So it might be your environment. So whether you're living somewhere that you have access to nature and, you know, the amount of pollution. It could be how well off you are financially, because if people are struggling financially, then they have a poorer quality of life. It's also social, so your relationships in your friendships, but also your relationships at work, whether you feel you belong where you live, you belong in your community. It'll be things like personal safety. So if we're thinking about people's quality of life, you know, in the UK, we're generally pretty lucky that our personal safety is is good, or in the rest of Europe. But some people might be living somewhere that their own personal safety is compromised because of their environment. So that would impact on your quality of life, whether you've got a job, but also what that job is like. Is it a secure job? Is it a job you enjoy? Are the hours reasonable? Is the pay fair? And then your emotional well-being. And obviously your emotional well-being will be very much linked to your quality of life, but you know, you can have impacts on your emotional well-being, like your mood, and you can have mental health issues like depression that would have an impact on your quality of life. So really, quality of life encompasses all of these different things. And I like this quote here, which is, it's not the years in your life that count, it's the life in your years. And that's very true. And when you ask, when people do research in quality of life, quite often what they find with different conditions is that patients will say they are happy to take a reduction in their length of life if it can be traded off with a better quality of life. So, for example, when you're asking people what kind of treatment they want, a lot of people would prefer to live slightly less long, but for the life they have to be really a full life, and they be better during that life, rather than have a poor quality of life for more years. Okay. So now we go back to our Mentimeter, and this time it's not a multiple choice, it's a word cloud. So you've got 3 words or short phrases you can put in to say what is quality of life to you. So I've kind of given you a little idea about the different things that impact on quality of life, but can you write down words that express for you what you think is important about quality of life? So we're seeing words appearing. And what we'll find is that if anybody says the same words, they will get bigger. So we can see that here, well-being is a little bit bigger. So a few people will have said well-being. So we've got well-being, community, happiness, not having any pain, independence, that's a really important one, serenity, comfort, good health, life experiences, social functioning, psychological, physical functioning, belonging, freedom, self-love, safety, happiness. We've got a few people have said that. How much sickle cell impacts you daily, how you feel pain-wise. What else have we got? Any other new ones? Okay. Oh, here we go. Good health, belonging, community. Okay, so here we go. We've got a few more. Love, self-love, had serenity, happiness and good health, community. Okay, so we're getting some ideas from everybody here about what people, how people define quality of life. And this is the World Health Organization, the way that they define quality of life. And they say that there's 5 different components to quality of life. So you've got your physical status and your functional abilities. So physically, how well you are, how much you can do, how fit you are. Pain will also be included in this. You've got your social interactions. There's religious or spiritual status. There's economic, vocational status and factors, and then your psychological status and well-being. So these are the 5 aspects of quality of life that the WHO Health Organization recognizes. And so if we're talking about quality of life in sickle cell, or with anything really, we have to think about how do we measure quality of life, and that's really difficult. The reason I've done these photos is that this huge stack of papers goes to show you how many different questionnaires exist, and there's just thousands. I think it is really thousands of different questionnaires that say that they measure quality of life. And of course, we would all like it if there was like one nice, easy measurement that we could compare between people. And this cat has wants quality of life with a hug. But anyways, so it'd be nice to have a little measurement to say, oh, my quality of life is this. And then you could do something and then say, oh, my quality of life has gone up, or, oh, my quality of life has gone down. But of course, there is no single measurement, okay? We've got to find different ways of measuring it, and often it will be with these different questionnaires. And today I thought I would speak to you about a fairly old piece of research back in 2005. So this is the name of it, the Health-Related Quality of Life in Sickle Cell Patients. It's called the PICES project. Published in 2005 in a journal called the Health Quality of Life Outcomes. And the main thing they did is they used this questionnaire called the SF36, study 36 items short form, to 308 patients in their long-term study called the Pain and Sickle Cell Epidemiology Group, okay? And QOL is the way that we abbreviate quality of life, and HRQL is health-related quality of life. So just to give you a little bit of information about the PICES study, this is a longitudinal cohort study. What does that mean? It means that we're not asking patients a one-off. It's not a study where we're doing something, taking some measurements as a one-off. It's a longitudinal, which means that they start off with their patients and they follow them for some time to see what happens. And there were 300 adult patients with sickle cell. And the reason this study was designed was to understand pain and response to pain. But what quite often happens in clinical studies is you might design a study for one thing, which is in this case the pain and response to pain, but actually you, as part of it, you can measure other things. Okay, so when they're doing quality of life, that wasn't the main part of the study. The main part of the study was pain and response to pain, but they also studied quality of life, and they really wanted to look at what could be altered to change people's outcomes. And they enrolled 308 adult patients with sickle cell from July 2002 to 2004. I should have written where it was. It was somewhere in the States. In fact, we can probably go back and find out. No, unhelpfully, I've not written it down. It's not on here either, but it was in a hospital in the US. And what does it mean, a cohort study? So when you're doing a lot of studies in medicine, you want to do the best study you can do is a randomized controlled double-blind study. That's like where there's the minimal risk of bias in your study is when people are picked at random. A cohort study means that you've kind of picked, it will be one hospital that will say, we're going to put all our patients in the study. But really, if you think, especially if we're thinking about quality of life, it might depend where those patients live. So is it in a big city? Is it in the countryside? Is it a hospital that has a good sickle cell center? Is it a poor sickle cell center that doesn't have a lot of specialist care? All of those things will impact the results. So a cohort study is not the best study that we can do. However, I'm still going to present the results because that's the study that they did. So they used this questionnaire called the SF36, which is it measures a range of symptoms, experiences, and patient health outcomes across 8 domains, okay? So the domains are physical function, so it asks you questions about how well you can go up the stairs, you know, how long it takes you to get up in the morning, these kinds of things. Bodily pain, so this is how, you know, for example, in the last 5 days, how many days have you had any pain at all in any part of your body? It measures vitality, which is sort of like energy. Role emotional and role physical is your perception of how well you can do what you're supposed to do because of physical or emotional issues. So for example, if you're somebody with depression, you might be physically healthy, but you would say, actually, I wasn't able to go to work because I was so depressed I couldn't get out of bed. Even though there might be nothing wrong with you physically, your emotional state meant you were unable to get out of bed to go to work. And role physical that's the role emotional, and the role physical would be, you know, emotionally you might be fine, you'd be ready to go to work, but actually you physically couldn't go out of bed because of pain or stiffness or other reasons. General health, social function, and mental health. So that's what the question, there's 36 questions, and they go into these different categories. Now, before I show you the results of this study, I thought we could do a little bit more of the Mentimeter, where people can enter some words again. What do you think affects your quality of life? Okay. I'm not going to answer this one. I answered the other ones, but so you can only answer. Well, I think there's people who have registered who don't have sickle cell, but it probably doesn't matter. Just everybody can answer. What do you think affects your quality of life? What factors affect your quality of life? This is completely anonymous, so please don't worry about writing something and then people are going to see what you think. So, I mean, for example, pain is a pretty obvious one. I'm expecting a lot of people would write pain, but I suspect there'll be other things than pain. Pain and health, work, relationship, yeah. Community, symptoms, revenue, absolutely. Anybody else going to chip in with their thoughts? Wow, lots of things. Okay, stigma, pain, community, school, sickle cell pain, fatigue, mental health. Oh, that's coming up nice and big. I think that's affecting a lot of people. Symptoms, work. Anyone else? We've got 5 people have answered. Don't know if anyone else is wanting to chip in. Okay, I will move on. So if we're thinking about sickle cell, these are my thoughts about what kinds of things might impact people's functional status. So how well you can move about, function, do what you're supposed to do what you want to do, and health-related quality of life. The most obvious one to me is pain. Obviously, all the disease complications. So if somebody's had a stroke, that might have a massive impact on their ability to function. Retinopathy, if somebody's got abnormal eyesight as a result. Leg ulcers, extremely painful, very disruptive. More long-term things like renal dysfunction, so people who end up on dialysis. So all of these different issues to do with the sickle cell itself could have an impact on quality of life. So we've got pain and complications, but also repeated hospitalization. So if you're repeatedly having to come into hospital, it will affect all sorts of things. Some obvious ones like how well you're able to do your work or do your studies. If you're having to come into hospital and it interrupts your professional or academic life. But I think with repeated hospitalizations, there'll be other issues, not just that particular short-term interruption, but also how you might think about the future. So if you generally don't come into hospital and suddenly you have to come in 3 times over the course of 6 months, you might start to feel a bit hopeless about what the future is looking like. Or when you're in hospital, it's a lot of people will experience maybe dehumanizing is too strong, but when you're a patient in a hospital, you're at the mercy of the people who are looking after you and at the mercy of your condition. So that might have an impact on your mental well-being even after the episode has actually passed. Fatigue is obviously a really important one that has a big impact on people's quality of life and ability to get on and do the things they want to do. Having a rare disease. So if you're somebody who's never really met anyone else with sickle cell and you feel really isolated, that can impact your quality of life. Stigma and racism are big ones that certainly in Oxford we've been doing a lot of projects about. So now I'm going to present to you the results of this study, okay? So this is a graph showing you across those 8 domains how people with sickle cell have done compared to the general population. So on this axis, you've got 0 to 100. So if people answer that they feel 100% physical function, it would hit here. 100% raw physical, it would hit here. Okay, so bodily pain, general health, vitality, social functioning, raw emotional and mental health. This would be 100%. So they asked some people who don't have sickle cell, and that's the answers that people have given in red. And obviously, so we've got 308 people who have sickle cell, which is the answers in blue. And then we have about 300 people who don't have sickle cell, who are age matched, right? So you can't really compare how the vitality, energy levels of somebody who is 19 years old with somebody who's 99 years old, okay? So you have to match your two populations. So you've got your cohort of 308 people, but then your controls, you obviously need to make sure your controls don't have sickle cell, but that they're the same gender and age as your group, okay? So now we're gonna take these one by one. If I can find the arrow, I don't know what's happening here. I don't know why this thing is getting in my way. Right, the arrows here. So first is physical functioning. So in red is the general population. So if you ask people in the general population how well they feel physically, it hits a 90%. So 100% would be people are incredibly fit. And then the sickle cell patients, those 308 people, they were down at only just above 60%. Okay, so that's a really big difference from 90% down to 60%. Then there was the raw physical. So that's the extent to which your physical health causes you to accomplish less at work or in your activities of daily living than you would like, or that limits you in the kind of work or other activities you can perform. So maybe you would have liked to be a personal trainer, but because of your physical health, you're not able to do that. And so as a result, you've taken a job as a secretary because you'll be sitting down all day instead of exercising all day. So that would lower your score if the choice of work that you've made was not the one you would have liked to do, but you've had to change it because of your condition. So the general population, they reached again almost 90%, and the sickle cell population was all the way down to 40%. Okay, so that's a huge impact. What about bodily pain? Interestingly, the general population hit about 80%, and the sickle population hit about 50%. So this is not the amount of pain. It doesn't mean that the general population have more pain than sickle cell. It means that the sickle cell population are more impacted in their day-to-day life than the general population because of bodily pain. Next one was general health. The general population answered 75% and the sickle cell answered 40%. So generally, how well are you and how does that impact you? Vitality, so that's energy levels. General population was 60% and the sickle cell population was 40%. So again, not doing as well as the general population. Social functioning, the ability to make friends, to meet up with them, to have your hobbies, to see your family. The general population hit almost 90% and the sickle cell population was down at 60%. and then how much you're impacted by your emotional issues in your role in society and amongst your peers and family, etc. The general population was on 80% and the sickle population was on 60%. And last but not least, mental health. Interestingly, the results for the general population and the sickle cell population was almost identical at 70%. Okay, so what we can see, unhelpfully, I've not put all the results back, so I'm going to go back and back and back. What you can see is, if we look at every aspect of people's quality of life as defined by the World Health Organization and as measured by this particular questionnaire, apart from mental health, where the general population responded about the same as the sickle cell population, the sickle patients were doing less well compared to the general population for each of those specific aspects of quality of life. So they were more impacted in their quality of life by their condition. So the next question is, what can we do? One idea about what we can do about this is peer support. And having a peer support group means you've got a space of caring, support, and uplift. It's an opportunity to speak your truth, to receive support from others who understand and care, to receive inspiration from others, and to have the chance to support others, because sometimes being able to help others is as important in people's lives as receiving help from others. It's an opportunity to build your network of friends and supporters and to receive information to help you live a fuller life. So a peer support group can be a very good way of improving people's quality of life. What about doing better research? So if you noticed, the information, the study I showed you was from 2005, which is quite a long time ago, and also it had only 300 patients in it. And the reason I didn't show you the results from a 2021, or let's forget the pandemic, but like a 2019 paper that had 30,000 people, is because it doesn't tend to get done. And so one thing we have done with EuroBloodNet and ASCAT, for those of you who were there back in 2019, in fact, we did a top 10 research topics for sickle cell. So we had a group of about 30 people from actually all over Europe and even other places outside Europe. And we talked about what is patient involvement in research. And people started to have a think about what questions they'd like research to answer and research studies to fix. And then everybody put their ideas on Post-it notes, and then we organized all the ideas into themes, and then we discussed all of these ideas and we agreed a research topic for each theme. And then we had this fun part where we gave everybody 10 Post-its and said, imagine that these 10 Post-its are $100 million. Which of the research studies would you fund? So people had their Post-it notes and were looking at all the different research studies and thought, this is where I would put my money. Then they had to, then we added everything up to see how many, which was the winner. And then we got our top 10, and then we presented the data back at the conference. So these are the top 10. Number one was, how can we find a universally available cure for sickle cell disease? And number two was, how can we improve quality of life for people living with sickle cell disease? So I'm not going to read through all of these, but I just put a star here to show that actually quality of life is extremely important for people with sickle cell, and that we want research about this. Okay, so can we do more research? So in order to try and answer this question, in Oxford we're running a study called RUDY, where we've got sickle cell disease there, and we are enrolling people into this study, and it's all questionnaires like the one I showed you. And the idea was to have thousands of people with sickle cell participating, so we could start to tease out what are the bits about people's quality of life that needs to be improved. Now, unfortunately, we have really struggled to enroll people in this, and I'm not really clear why. And maybe I'm just going about it the wrong way, and there's better ways of doing it, and I just wish I knew what they were. but essentially it's people put in their details and then they answer questionnaires. So that is, I think, my last slide, because the point is not just for me to talk, but for all of us to have a discussion. So I will stop sharing here, and I'm hoping we can all discuss these issues of quality of life. Any volunteers?
Thank you, Noémi. Sorry, I jumped in, cutting you. So I said before, you can both raise question in the chat. I will now also give the possibility to unmute yourself for those who prefer to talk instead of writing. So starting from now. So don't hesitate to take the floor for not only raising questions, but also to share comments, feedback, or any thoughts you could have during this discussion.
Nobody, everybody's stunned. It's not an easy topic.
I have a question.
Yeah.
So the study took place 17 years ago. Since, has there been any other similar studies, or is there plan to run future studies?
Yeah. So there are other studies. There's few dedicated studies that just look at quality of life. It's more, so quite often quality of life is being used as part of another study. So if somebody says, like, for example, the new drug crizanlizumab, they will say, oh, we'll have a questionnaire alongside it to see if it improves people's quality of life. Because at the end of the day, improving people's hemoglobin or reducing people's reticulocyte count, or all of these things that we doctors like to measure, is actually of no relevance to the patient. And, you know, there's a good reason to think that actually every study for every drug for every disease should always measure quality of life, because if we can't improve quality of life, what's the point of doing it? Maybe mortality would be another issue. So yes, for me, you're right. There are other studies, but there's no good, you know, overall thousands of patients, lots of detailed results with plans to then do something to change people's quality of life. And that was my idea about starting the Rudy study, is that I wanted to involve patients in the design of it, so that when we get the results, when we have lots of people enrolled and we get the results to find out what aspects of people's quality of life needs improving, then I would work with the patients to then design the next step, which would be, how can we improve that? So if it's fatigue, how do we improve fatigue? If it's sleep, if it's mood, if it's, you know, to really pick the area.
Thank you very much. Any other comment? Maybe I can ask you a question, because in general, quality of life is a very challenging topic of research, because it crosses many cultural criteria or very subjective criteria. So I would like to ask you both, I mean, from a patient point of view, if there is a method for having a more or less universal criteria for measure quality of life from one hand, and
sorry, Maranja, can you explain that again? Sorry, can you rephrase that?
Yes, in the sense that quality of life has many criteria. I mean, as method of research, when quality of life is the center of the research, are many items and criteria that are difficult to apply in a objective way, because there are many criteria that are subjective or not quantitative or linked to each culture. For instance, I can give an easy example. I'm from the south of Italy. For me, the sun is a quality of life criteria. Maybe for someone who is from the north of Europe, it will not be in the first list. So my question is, if in your opinion, you that are at the center of this research for sickle cell disease, if there are some universal criteria that could be applied beyond the subjective and beyond the cultural differences.
So it's very, very difficult to do that. And also when people who study quality of life, they're always balancing between asking lots and lots and lots of very detailed questions, because that makes it more quantitative. So if we were going to do pain, you could say, you know, I would write a questionnaire that asks how many days you have pain, how long the pain lasts, what type of pain is it, does it go away when you take painkillers. So you can imagine a really long questionnaire, which would be very boring to fill out. And so people are not likely to fill it out, in which case there's no point having it. Or a questionnaire that's very short and people will fill it out, but then is it really useful if we say, did you have, you know, how many days a week do you have pain? And people just say 3, 7, 2, we don't know. Is that pain for 1 minute? Is that pain for 5 hours? Okay, so that's always the balance people doing quality of life. You want to make sure you're asking enough questions that the data means something, that you can then analyze it, versus not so many that people don't answer it. Did you have another question? There's some questions in the chat.
Yeah, there are 2 questions in the chat. So the first one is, what point is the Rudy study at now?
Yeah, so the Rudy study, at the moment we have about 50 people who have filled in the questionnaire. So what I've learned is that we went too far in one direction. There's 13 questionnaires in there, but if you answer all 13 questions, it should take about an hour, and you don't have to do it all in the same day. So for me, who I don't have sickle cell, I don't know what it's like to live with sickle cell, I think, oh, that's all right, once every 6 months to answer 1 hour of questionnaires. But obviously this is not working because people are not doing it. So we're trying to analyze the data from 50 people, but 50 people is not enough to really, because you have all the different ages, etc. My other worry, sorry, I had made the bad decision to come to the kitchen to do my talk, so my husband is washing some fruits, in case anybody's wondering why there's funny noises. The other problem is, my other worry is that the people who are answering the questionnaire are probably the people who feel well in themselves. If you're not feeling well, you're not going to bother to do the questionnaires. So you're skewing the data already. Okay.
Thank you. Then there is a question from Alexis. So I'm concerned about the problems to get a job. Do you have information about this issue in sickle cell disease population? I think it's very related to quality of life.
Absolutely. So there are people who have studied employment. So we know that people with sickle cell are less likely to be in full-time employment, less likely to have as much education, like, you know, as the education would go as far in terms of university degrees, etc., as the general population, you know, age-matched population. There's probably more work on this in the US than in the UK. Some people have done some nice studies where they've done a link between MRI scans, which shows that the more silent infarct you have, so a silent infarct is when there's an area of your brain that we can see on the scan that hasn't had as much oxygen as the rest. And it's like a stroke, but it's not a stroke that you're paralyzed. It's a stroke that that affects basically how much oxygen goes to your brain. And there's a direct link between how well people do at school and the number of silent infarcts in the brain. So that's telling us that there's a direct link between the biology of the sickle cell and how much sickling there is and how much it's affecting the blood flow in the brain, and people's educational attainment and work attainment. There is some nice work from the UK about getting jobs, and out of that work came out, which I can send to Mariangela and she can send to everybody. There's a really nice booklet for discussing with your employers about the fact that you have sickle cell. What are the things that you need differently from other people in terms of, you know, not having the desk that's right under the fan or things like that. What else was I going to say? Yes, again, you know, anecdotally, I know some people with sickle cell who definitely had to, you know, cut down the number of hours that they work, or choose to work in a different, like, for example, if you're a pharmacist, you might think, you know, intellectually you'd love to work in a hospital that does clinical trials, and that's the kind of pharmacist you want to be, but actually you might end up working in a pharmacy in a supermarket, because that will not be as stressful, because there won't be the pressure of doing the clinical trial. So certainly I do think people with sickle cell will often make choices, not always, but sometimes will make choices about their employment based on their condition.
Thank you. So the next one is, do you know if peer support group or other factors really improve quality of life in sickle cell disease?
That's a really, really good question. And I feel I should do a little bit of a literature review before I answer it. Again, anecdotally, absolutely. The peer support groups do have a really big impact on people's quality of life, anecdotally, from my experience with the people who join them. And it's not just mine. We've talked about this again nationally. I'm not sure if anybody has studied that, right? So again, that will be very difficult, because you're going to have two cohorts, one cohort that has a peer support group and one cohort that doesn't have a peer support group, and look at, you know, and measure their quality of life. But it would, if that study hasn't been done, Maria, then I think we should do it. It's a good one.
I agree. Indeed. And so I can see another question. Is the public patient's involvement in the RUDY study?
Yeah. Yes, absolutely. So RUDY itself was not set up for sickle cell. It was set up initially for people with musculoskeletal disorders like rheumatoid arthritis. And then I went, it was a guy in Oxford that started, and I went to see him, and I said, oh, you know, this is exactly the same for sickle cell, joint pains and all that. It will be the same for our patient group. So the study itself was set up with PPI, but also the way we're running it for the red cell patients in Oxford, we have a PPI group. Of course, you know, we've just had the pandemic, so the whole thing kind of fell apart. But even, I would say, even before the pandemic, I think even the PPI group struggled a little bit to try and find the reasons why so few patients enroll, or rather, in fact, I could probably show you, I'll share my slide. It's not just that few patients enroll, even the patients who enroll then don't do the, don't answer the questions. So let me show you our graph of enrollment. Okay, so this is the first 12 months. I will share that now. And I will do slideshow from current slide. So you can see we approach, so we did this, we've got a research facilitator who was working on this. She approached 200 patients in the first year. So she spoke to each patient after clinic, either before or after clinic. So she spoke to 200 patients. She went to 3 different clinics. One is called the Whittington in London, one is called Oxford is Us in Oxford, and one's called Milton Keynes. So these are the number of patients who were willing to participate. So when she approached them, almost 150, so say 130 of them said, yes, this is a good idea. I would like to be part of this study. So out of 200, 130 said, yes, I'd like to be part of this study. Then they have to consent. So they have to sign you just log in online and you consent yourself. So only 50 of those consented to say, actually, yes, I'm going to do it. And out of those 50 who signed in and said, yes, I'm going to do it, 13 completed the questionnaire. So out of 200 approached, 130 said, yes, I would like to do it. Only 13 filled out a questionnaire. So it's been incredibly difficult. Any other questions about quality of life?
I see no more question in the chat, but of course we can wait some minutes for see if they arrive. And also I encourage also to take the floor and share.
Please just pitch in, guys. You know, it could be your experience, it could be, you know, I'm quite interested to hear, for those of you who are patients, you know, are your medical teams interested in quality of life? Is that something that you get asked about? Do you feel your medical team is there to try and improve your quality of life, or they're only really interested in your physical well-being? I mean, just love to hear some more about that. I don't know if this is just, maybe it feels too personal for people to speak up about it. I don't know. Maybe I should have done more Mentimeter questions to get people's viewpoints.
Hi, perhaps I can give like some input
Yeah,
around quality of life.
sure.
I think in general, with or without a condition, we all ask what's the quality of life, what's our purpose, this, that, and the other. And I think from just seeing what, you know, the input for today, and, you know, especially when I think you've mentioned about questionnaires and stuff. And yes, I've been in that category. Oh, I'm willing to do it. And then when it comes to it, it's like, oh, do I even want to think about that today? Because it is constantly on our mind, whether we like it or not. And I'm not trying to generalize. We're trying to live the best life. I'm a patient with sickle cell. So we try to live the best life. But when you're dealing with sickle pain, or not even just pain, because you one sickles every day, there's nothing to run away from. You know, you wake up like, what's today going to be like? Okay, so you can have a positive outlook, but there's this constant, like, I call it the invisible suitcase, you know, of, okay, I'm living my life, but there's this other thing there that I can't just get rid of. And so quality of life, yeah, we all, in general nature, the human beings, we all want the best quality of life. But when there's a condition that you're living with 24/7, I just find, for me, when questions are put to me, it gets me to think and be reflective. Sometimes it's a bit mundane. Sometimes it's a bit to do it as an active thing. It's a bit long-winded, and then what am I left with?
Yeah.
Do you see what I mean? What am I left with? Then I'm left to like think about quality of life that I sometimes try to park away. And no, it's not something that is often thought about when I go to clinics or whatever. It's usually because of time restraints as well. How are you? What's going on? Let's look at your health, this, that, and the other, investigations. Okay, if there's any other problems, signpost to therapy if you can get on that list, or if you go private. So generally a lot of things are done for me outside of. Do you see what I mean? But
so you're saying it's not being ignored, it's just there's no space for it?
There's no space for it, but it's important to have it. It's important to have it. And I don't know if it's because it's under the guise of sickle cell, because other conditions, they do factor that in, you know?
Yeah, so one thing I haven't shown you guys, in fact, I can share my screen, and I did include it in the presentation, I put it at the end, is actually they did compare to other chronic conditions. Because obviously some of it will just be about the fact you've got a chronic condition, but so it's the next slide. So I don't know if you guys can see this. We've got, this is the sickle cell patients are in blue, and then in red are the dialysis patients. So these are not sickle patients who are being dialyzed. They're like diabetes, high blood pressure, other reasons. Green is cystic fibrosis, and asthma is purple. And you can see that actually, for example, for physical function, people with sickle do better than people who are being dialyzed. But I was really interested in the fact that the green ones, the cystic fibrosis, do almost better than everything apart from general health than any of the others. And we often compare sickle cell to cystic fibrosis because they're both recessive genetic conditions, both rare, but we often use it as a sort of proof of racism that cystic fibrosis has a lot more funding than sickle cell, even though it's like as common or as rare. But sickle cell affects more people of Afro-Caribbean background compared to cystic fibrosis. So we kind of use it to say, well, there must be racism if we're not getting as much funding for sickle cell. And these guys are just doing so much better almost across the board. And it could be, because, you know, we don't know obviously, but it could be that there's just more, there's even that the healthcare is organized more around them. There's more specialist nurses, there's more psychologists, there's more, you know, they're having longer appointments, where more of their issues are being sorted out than sickle cell, for example. I mean, obviously, I'm just extrapolating, but it's interesting that what's happening in sickle and the other conditions is not necessarily the same. So it's not just the fact of having a chronic condition when you're comparing between chronic conditions, some of those quality of life do differently. Okay, so yeah, I think
yeah, thanks for sharing that, because you know, cancer can affect anybody, but so when you're talking about other things, alternative things that are happening, you know, you might get a massage, and all those things kind of help with quality of life.
Oh yeah.
Do you see what I mean? So it's like and I do agree with what you've shown. I totally agree with that. You know, sickle cell affects a certain category and race of people. However, with a lot of these, thank God to like webinars and stuff like that, I'm getting exposed to more and more in Brazil, in Spain, in this, that, and the other, as some of the colleagues, delegates that are on here today. So there is a lot more that needs to be done. But yeah, and I think someone put in the chat, I was just reading it, that even saying you need some kind of support to do with mental well-being, it's
Absolutely.
like you're off your rockers. And it's like, no, I need help to try and live a normal life as possible with this condition that is actually life-threatening.
Yeah, life-threatening and life-impairing in your day-to-day, in your, I mean, I often think about the way that people project themselves into the future, and that, you know, if as a child you were either had a lot of pain and just couldn't, you know, you struggled to carry on going to school every day, and because you're always like falling behind and things like that, what you think about your future and what you might be able to do with your life would be impacted by that. And obviously, and then not even to add in about people, how long people are likely to live, right? Because a lot of people with sickle cell will have been told when they were little that they wouldn't make it to adulthood, or that they would die as a young adult. You know, how do you move on from that way of thinking? It has a massive impact on your well-being, and all of those traumas need to be, and then there's all the traumas people have received from horrible hospital admissions and different ways of being treated. All of that trauma needs to be healed. We need to go back, get a psychologist, and go back and make people go through that talking therapy. And it's awful going through it because you're reliving the trauma, but the only way to really heal it and allow you to move past it and be able to blossom in your mental health and in your rest of your life is to go through that healing process, which is a big deal. It can be very painful to go through it. So yeah, Naomi's saying, I wonder if anything serious is going to be done for us. In the UK, we now have a better way, you know, mental health for sickle cell and all inherited anemias is now well recognized. But if you look at what's happening in Oxford, so we've got extra funding, yay, we have somebody who can do 2 days a week for all our patients. So of course, you know, that's not going to go very far. We need 5 people 5 days a week, really. We need 5 psychologists 5 days a week. But we're not there yet. Anyone else?
Can I just say, it's been, you know, it's kind of like hearing you say, you hit the nail on the head. You know, life expectancy, what are the aspects? It affects whether you have children, do you want to settle down? And these things sometimes are unspoken, not even forgetting that your family doesn't fully understand what you're going through, or even if you're married. So it's a very isolated condition, and you hit the nail on the head. There's silent trauma and not recognizing that. you know, to even hear, oh, yeah, don't bother, by 13, that's it.
Yeah.
You know, so you're wondering, oh, okay, another birthday. So it's not all doom and gloom, but yeah, hearing you say that has been a fresh breath of air, because there's so much misunderstanding, and then to do with within our own community, the stigma.
Yeah. Yeah, I think so in Oxford, we've done a lot about racism, and, you know, we're still trying to work to try and improve things with that. But actually, we haven't done so much about stigma, which is very different from racism. And the stigma, you know, like Noémi was saying about not being taken seriously about mental health. So that might be like your medical team is not taking you seriously, but it might also be within your family. And there are some cultures where there's stigma around having sickle cell, and there's stigma around having a mental health issue, and there's stigma around, and then if you've got both, it's like, you know, there's nowhere to go, and it's a very, very difficult thing to try and do anything about. And that's where, I don't know what your name, GA, all I can see is GA for your.
Sorry, it's Gina.
Gina, hi.
Yeah.
So the other thing is, in a way, that's where I think the peer support is really good. So because the peer support is with people who do know, because they do have your condition and they do know what it's like. And in our peer support group, which we started before COVID, was face-to-face, now it's all online. There were some really, really interesting conversations between, like, so there was, I mean, I don't want to talk too much detail about individual cases, but I just want to say that I have witnessed really helpful conversations between patients and, in fact, the parent of a younger patient, where it really took that peer conversation to happen for the parent to go, oh, I hadn't realized. I thought he was just being lazy. I thought he was just being this, being that. But that parent needed to hear it from another patient, from an adult patient, that actually, yeah, no, the way what your son is doing or describing is really real. It's not just being a lazy teenager or whatever. The fatigue is really there. So that's where I think the benefit of the peer support group is.
Yeah, I can agree with some of that. I'll be honest, I did shy away from support groups and peer support groups, because sometimes, well, for me, it was a lot about the condition and this, that, and the other, and the problems and the pain. And it's just like, oh, did I leave there feeling impacted, or did I leave there like, oh my gosh, is that what it's like, you know? However, having said that, I think COVID, I've joined a few within my area, but when I say a few, I've joined a few of the meetings, not ones all over the borough or whatever.
Yeah.
But having COVID, really, I thought, okay, let me find out what other people with sickle cell are doing, because, you know, how COVID is affecting and this, that, and it has been very, very helpful to understand what's out there, you know, the changes. Okay, how do we support one another? So I do agree with, I have changed on my attitude towards support groups. So yeah.
And you've got to find the right one for you, right? I mean,
yeah, absolutely. Yeah.
Anybody else have any thoughts they want to add in? I realize that this is, you know, what I've done today is mostly describe something that you're all already aware of. I wanted to show a little bit about the research that's happening, so that people can see that, yes, there are people who are interested in this and people are trying to study it. I wanted to show how difficult it is to study it because of the limitations of by definition of the way that it is studied. I wanted to talk about my study, the Rudy study, and Janine, I'll look forward to receiving your email, because I'd really like to hear a bit more about the other one you're involved in, and the mistrust issue, which we have thought about. But I also realize that it's a bit depressing, isn't it? You come to this, it's going to be about quality of life and sickle cell, and all I've done really is say your quality of life is not as good as if you didn't have sickle cell, and I haven't got an answer for you apart from the peer support. And so I can see that. But also, I mean, I hope if this is a topic of interest, please do get in touch with Mariangela. We have a blog. EuroBloodNet has a blog about sickle cell, and that might be nice to have somebody write something about quality of life. And the whole point is to spread these ideas in the community so that people can come together. And you know, I truly believe that the people who will come up with the best ideas will be the patients themselves. So that we have people coming together and saying, right, this is something that needs to be done. Now, obviously, we need money for everything, but what we, the doctors and the medical team, are here for is to support you. And if you came to me or another doctor or whatever and said, look, we really want to do this about quality of life, and this is our idea, you could find doctors and scientists who will help you to write the funding applications and all of that to make that happen. Of course, it is a lot harder to get funding for quality of life than it is for like some fancy new drug, but it is doable. And certainly, again, in the UK, we've got something called the NIHR, which is government-funded research, which is very, very keen on PPI, so patient involvement, patient-led things, and is very keen on quality of life and improving things for people's lives. So, it is doable. But of course, what I'm saying to you is you're all people who are already living with a condition, trying to live the best life you can, trying to, go to work, have your families and all of that. And I'm saying to you, oh, you also need to do some research, by the way. So it feels like it's a lose-lose situation. I can see that.
Okay, so I think we have more or less addressed all the questions. I would like to thank a lot Noémi for being with us and having shared their expertise with us, and also all the audience for having followed this webinar and participate to the debate.